my name is Emily. I'm going to be the student physical therapist working with you today. Do you mind confirming your name and date of birth for us?
Yeah, my name is Mary. My birthday is 4/16/97.
Sounds good. Thank you very much. Do you mind telling me kind of what brings you?
Yeah, I'm having a little bit of foot pain here. Kind of like goes in and around down to the bottom of my foot a little bit.
Okay. Can you kind of describe that pain for me?
Yeah, it's kind of achy and it kind of like feels different, like achy and like burning kind of sometimes.
Okay.
If that makes sense.
Yeah, no, I totally understand what you mean. Did anything happen or just kind of started?
Just kind of started. Okay. Going on for like maybe a couple of weeks now.
Okay. And then on a scale of 0 to 10, what would you say your pain is currently?
Right now, maybe about like a 3.
Okay. And what kind of things make your pain worse?
Definitely like when I'm doing more of my activities and like standing and walking, and I'm a sprinter, so that definitely flares it up.
Okay. And then when it's flared up, about how high on that 0 to 10 scale does it get?
I wouldn't even say it's like painful, but like the weird sensation kind of gets up to like a 6 or 7.
Okay. And then is there anything you've noticed that kind of makes it better?
Just rest, getting off of it.
Okay. And then about how low does it go on that 0 to 10 scale?
Like a 1 or 2.
Okay. And then I was just wondering, I know you filled out this form for me, but could you confirm? I think it says here that you have diabetes. Is that true?
Yeah, I've had it for a while. I think I was born with it.
Okay.
So yeah.
And then I know you circled no any of these other health conditions, but I want to confirm you have no other kind of medical conditions going on.
No, diabetes is all. Yeah.
Okay. And then just some questions we ask everyone to make sure you're fit for physical therapy. Have you had a fever recently?
No.
Does the pain ever kind of wake you up at night and not let you go back to sleep?
No.
No. Do you have any numbness and tingling in the other leg at all?
No, just the one.
Numbness and tingling anywhere else in your body? No. Any change in weight recently?
No.
All right. Sounds good. We're going to get into some testing, kind of see what your foot is looking like.
Okay.
All right, we're going to go over some of the things concerning tarsal tunnel syndrome. The epidemiology is that it's more common in females. It's more common in people with a past medical history of diabetes. It's more common in athletes, especially those in sports that include sprinting and jumping, or prolonged weight bearing, either due to occupation or recreational activities. And those with flat feet are more prone to tarsal tunnel syndrome. And then the subjective, so when your patient comes to your clinic, they're going to report burning or tingling on the heel or the sole of the foot, which is most common, or they may report pain directly over the tarsal tunnel that kind of shoots into the medial arch of the foot. They may also report numbness on the bottom of the foot. Some may just not notice the change in sensation. It's typically unilateral. And then the aggravating factors are walking, prolonged weight bearing, dorsiflexion eversion, or wearing high heels. The alleviating factors are rest, elevation, or removing shoes. Some of the differential tips that I found when reading through the research is that since this is typically unilateral, it's probably not polyneuropathy, which is something to definitely consider with the past medical history of diabetes. There's no change in reflexes associated with tarsal tunnels, so that could help you differentiate some from some other things in the chart. And the location can be very similar to plantar fasciitis, but tarsal tunnel has reports of burning and sensation changes, which is not typical for something like plantar fasciitis.
All right, we're going to get into some testing now. So if you don't mind, will you bring your foot up on this nice stool I have here for you? So the first thing I'm going to do is I'm going to kind of dorsiflex and evert the foot. Does that change anything?
Like a little tingling a little bit.
Right along here that you're kind of saying? Okay, the other test we're going to do is I'm going to bring your toes down, bring your foot in, and kind of compress with my fingers back here. Does that bring on kind of your symptoms?
Oh yeah, it's kind of starting to tingle a little bit.
Okay. And then the last one I'm going to do, I'm just going to tap behind here, and you let me know if that brings on anything.
Oh yeah, definitely.
Definitely?
Yeah.
Okay, so you go ahead and put your foot back down. So what it seems like you have going on is a little bit of tarsal tunnel, but what I want you to do is kind of rest, for a little bit. We might look at some orthotics for your sprinting shoes, to get your foot in a better position and go from there.
Okay, so
For the objective testing for tarsal tunnel syndrome, we reviewed the main positive findings, which includes the triple compression stress test, which combines ankle plantar flexion, inversion, and then manual compression behind the medial malleolus. The other option would be the dorsiflexion eversion test. Both of these would reproduce symptoms. The triple compression test brings on symptoms faster and more consistently than the dorsiflexion eversion test. And I understand they seem kind of opposites. One's dorsiflexion eversion, the other plantar flexion and inversion. The triple compression stress test decreases the cross-sectional area of the tarsal tunnel, thus recreating symptoms. And the dorsiflexion eversion test puts tension on the nerve, which would reproduce symptoms. Your other options are Tinel's over the tarsal tunnel, which is that tapping kind of behind the medial malleolus. And then you could also compare sensation on the sole of the foot side to side, since this is typically unilateral.